The first cases of novel coronavirus were reported in Wuhan, China in December of 2019. The virus, now referred to as COVID-19, has been linked to live animal markets in the Wuhan province. On January 20th, the first case in the United States was reported in Snohomish County, Washington. On January 30th, the World Health Organization declared COVID-19 a public health emergency.
The main reason for this declaration is not because of what is happening in China, but because of what is happening in other countries.
On February 26th, the first case of community spread in the United States is reported, meaning the virus was found in a person with no known connection to another case. In the weeks since, coronavirus has spread to over 350,000 people, claiming over 16,000 lives. The disease now joins a list of other major outbreaks of the 21st century: SARS, MERS, swine flu, and most recently, Ebola. Which might lead you to think, if COVID-19 is the fifth major outbreak in the last 20 years, shouldn't we have seen this coming? This is Ben Rhodes, the former Deputy National Security Advisor under President Obama.
So I first became aware of the Ebola outbreak in the spring, summer of 2014, when we started to see in our morning intelligence briefings reports of cases of a new strain of Ebola, particularly in West Africa. So the first thing you have to do is understand the outbreak. And so you need to get testing and you need to figure out what is the source of this disease and where is it spreading. Once you do that, you can build an infrastructure around that area, both to contain the disease so that it's not spreading, so people aren't leaving there to go to other places, to treat those who have been sick, and then to set up precautionary measures to make sure that you can detect the disease if it inevitably does escape that containment zone and reach the United States, which it tragically did with Ebola. We should have learned to be prepared, and that's why there was a White House office set up to manage pandemic response that Donald Trump shut down. We should have learned that when you see an outbreak of a novel virus like coronavirus, you have to act swiftly and decisively in coordination with other countries to stop and contain it where it is before it can spread.
The voice you're about to hear is Ron Klain. Klain was President Obama's Ebola response coordinator.
After I left as White House Ebola response coordinator, President Obama accepted my recommendation to create inside the National Security Council a directorate that would focus on these global health security issues, that would have a high-level person that would be helping us get ready for potential epidemics like this, helping us get prepared, helping us respond. And President Trump actually kept that structure for the first year and a half of his presidency. But when John Bolton took over in July of 2018, he basically disbanded the unit. It didn't really fit with his hard power vision of national security. So I think there's a big hole there. And then, of course, there's a second leadership hole inside the White House, and that's the one in the Oval Office. As you guys know, right, President Obama made a very hard decision, a controversial decision in the fall of 2014 to say, I'm going to let science and medicine dictate the direction of this response, dictate our policies, not politics, not fear. And it was an unpopular decision in many ways. I think it's one of the braver decisions President Obama made. And he stuck with that through thick and thin, and he saved a lot of lives. Back in 2014, the leading forecast was that 1 million people would die in West Africa from Ebola. The death toll, tragic as it was 11,000. And now we have President Trump. President Trump attacked the Ebola response back 5 years ago. He called Obama a dope. He called Obama incompetent. He said we should leave Americans who are fighting the disease in West Africa to die there if they got the disease. And that's the person who's in charge, right? And so I think the leadership problem is at both levels. You need a commander-in-chief who can be trusted, whose word is good, who's willing to make the hard decisions and put science over politics. And then you need a structure inside the White House to implement those policies. And we really have neither of those two things right now.
The novel coronavirus has been actively written about since January. But when did the threat to Americans become real? According to Klain, COVID-19 hitting the United States was not a matter of if, but when.
We're far past where we ever reached in terms of the Ebola outbreak because we have failed already to contain this virus. It spread from China to many other countries. Once it reached here, we didn't have the testing resources to find it where it was. And so now we're in a place where, because the government wasn't able to contain this virus through testing and isolation and containment, that falls to us, which is why we're doing social distancing. It's because the federal response failed, and now it's on citizens.
At this point, many Americans have already seen their lives change in substantial ways. The stock market has seen trillions of dollars of lost value in just a matter of weeks, leading to economic uncertainty, mass unemployment, and fear. Schools and colleges across the country have shut down, opting instead for online courses. Elder care homes have begun to encourage individuals not to visit their relatives for fear of spreading the virus to those most vulnerable, and lawmakers are now preparing for the very real future that hourly and part-time workers are without work and without paid leave for months.
The challenge that we're facing now is that we will have difficulty knowing with certainty when this storm has passed, because we could avert some of the worst case scenarios in the next 2 months, and then you could see a reduction in cases in the summer months when it is hotter and more humid in an environment that is less conducive to the virus spreading, but then it could come back in the fall. I think the good news that people should feel is that that time should allow for the development and dissemination of more tests, so that when the disease reemerges, we're better prepared to deal with it, and we might not need the same form of extreme social isolation in the future. But I think we're looking at a new reality, a reality that involves a significant amount of social distancing for a very significant period of time, a reality that likely involves not just national but global recession and instability that could bring about. And so I think we will look back at this as one of those moments in time where there was a before and an after, and we're living now at the beginning of the after.
This is Dr. Abdul El-Sayed, an epidemiologist and public health expert.
All we're doing right now is about mitigating that worst case scenario. But let me be clear about something. It's going to get worse, and it's going to get worse for a while to come. There's going to be a lot of disease, and people are unfortunately likely to die of this. But what we're trying to do is make sure that we don't overwhelm our health system through this pandemic, so that we are in a position to be able to treat as many people as possible who become ill. But the idea that we can go back and contain it, and then we're going to be back to where we want to be in 2 weeks, that's just not happening. And so I want folks to appreciate that, like, we're tucking into this for a while. Everything that we're doing is about trying to, as they say, flatten the curve. The idea of flattening the curve is kind of like thinking about the levees to a city that's on the ocean. If you have a tidal wave that's big enough, it's going to crash over the levees and it's going to flood the city. So our hope, right, this idea of flattening the curve is about reducing the height of the tidal wave, and that tidal wave being the number of really sick patients at the same time who might overwhelm our healthcare system and force us to make decisions about who gets ventilatory care in an ICU bed and who doesn't. So all of this is about reducing the death that comes with this, and slowing the onset of disease. But I wish I could tell you that we could go back to 2 weeks ago and that we're all life is going to be back to normal in a matter of days. That's not the case. No matter what Donald Trump says, we are going to be dealing with this for a matter of months, and all of that is to save lives and to protect the most vulnerable people in our society. The best advice I've heard is that don't just worry about not getting it. Pretend like you already have it and worry about not spreading it. If you do those things, you're doing the right thing. But I know that in our bones, our leadership doesn't reflect that. But we've got a resilient people in this country, and I know we can rise to the challenge. And when we do, we will not only have helped solve the problem for ourselves, but help solve the problem globally. But it's a hard effort, and instead of looking backward, we got to look forward.
The reality is this is in our communities right now. And the final line of defense is you and the choices that you make. If you go out and around people, you're exponentially increasing the risk that you're going to contract this disease, that you could then pass it on to your parents or grandparents or somebody with a pre-existing condition that makes them vulnerable. But the flip side of that is you have tremendous agency to stop the spread of this disease. And the reality is, in a democracy, ultimately citizens are the last line of defense. And right now it falls to us in our own choices to do the right thing.